Okay, now it'll be easier now that I have Cynthia's email. Now things are
there's
easier.
Cynthia.
Yeah. You're on mute.
Cynthia, you're on mute.
I unmuted you. You're unmuted.
You can unmute me? What the fuck? You shouldn't have that. I'm muting myself.
Now you're muting yourself.
Yeah, I know. That's what I said. Why do you have that power to mute me?
Because he's the host.
Whoa, that's so fucked up.
Well, a host, I'm the host of the most.
Well,
you should have the power to mute people, but not to unmute them. That's so fucked up.
What?
I mean, I like having the mute button at least, because then I can mute the students.
No, but I'm saying the host should have power to unmute. I mean, mute, but not to unmute. What if someone doesn't want to be heard for a second and then,
What if someone's having sex?
I should write to Zoom.
I think at the end of the day, you trust you're going to have a good host and,
Well, clearly I can't, so.
I'm a good host. I was just showing you.
No, terrible.
You what was what.
So what was that cough?
Yeah, what was the ending of that story?
Oh, well, I don't want Ish to miss.
The climax?
Was?
It's possible that, wait, here he is. Wagwan. Oh, he's connected. Bless you.
Bless you.
Thanks.
So what's the end of this story about the cough?
So at the end of the day, the cough, I think, ended up being an asthma cough. And so I had to get some asthma medications.
So you had asthma and weren't aware that you had asthma?
Well, I guess I wasn't aware of the degree.
Got it.
I mean, first of all, I was like totally ignorant to what asthma was. I thought it was this thing that like you get a fit and you can't breathe all of a sudden, like you always see in the movies. And then they take their inhaler out. I didn't realize that it could be that even if you're not going into a fit, it could still be like affecting you during the day.
Mm-hmm.
You know what I mean?
Yeah, it can just make you tired.
Yeah, it can do a lot of things. It can make you wheeze, which I was doing. It can make it hard to like climb steps, and apparently
it can make you cough up a lung.
Yeah, apparently it could make you cough as well. So I just was not. See, like when you actually have a good doctor, and they actually, first of all, they see you. When they actually take you and listen to you and try to check you out like they're supposed to do, A, you can get diagnosed, but B, they can actually explain these things to you and be like, yeah, this is why you need to take your medication, because this is what it's going to do. It's not just like the shit you've been seeing in the movies for the last 30 years where you see the dude from the Goonies that has to take out his inhaler because all of a sudden he can't breathe. So I wasn't taking it because it wasn't doing that to me. You know what I mean? So they told me I had asthma. I was like,
they weren't giving me what I needed.
I was like, whatever. I got an inhaler, but I'm good. If that ever happens to me, I'll take it. But next thing you know, I like basically had to be a detective and had to start putting 2 and 2 together. Like, let me think about when this shit started happening. Let me think about boom, boom. Oh yeah, that's right. I got an inhaler, wasn't using it, was told I had asthma, this and that. Oh shit, maybe it's an asthma cough. Even that phrase, I haven't heard that as like some phrase that they use, but I got to put 2 and 2 together myself. So,
He's like, I got to come up with my own prognosis.
Yeah, I got to come up with my own phrases and shit.
I'm in Ghana with a cough. Like, this is too much.
Yeah, man, shit is way too much. But I will tell you, like, once I got the medications, like, shit was a lot easier to just to be, just to move around, walk up steps and shit.
So now you're fine?
I'm a lot better than I was before. A lot better than I was before. That's for sure.
So how long ago did this ordeal take place?
The ordeal with which one?
With you in the hospital, the second hospital, the one
The
that you had to
second?
snitch
Oh yeah,
on.
the second hospital was earlier this year, before the COVID shit hit.
Hmm.
And I'm telling you, the moment that I used those words on the phone, later on that day, 8 p.m. that day, I got the phone call from this doctor I've been trying to track down. Oh, okay, yeah, no one told me that you were looking for me, blah, blah, blah. Like, okay, well, you need to get new people then. Like, you need to get people who will get this message to you. Like, I don't know what to tell you. Oh, okay. Well, I thought we had a good rapport. Like, okay. Oh, well, anytime you have a problem, use this portal, email me, and I'll, get you what you need. Okay, cool. That's how it's going to be from now on. This shit is fucking ridiculous. That's our system. And you can imagine if I'm dealing with this, you can imagine how many people are dealing with this type of shit. That's our system.
Well, that's America's system in general.
Well, yeah, this is America.
But I mean,
Yeah.
it's not only a New York thing.
No, I didn't say it was. I didn't say it was.
It might be like a major metropolitan area like thing.
I'm sure it's
You have like
exacerbated by the population density and stuff like that. I'm sure it is. I mean, there are people who will tell you like, yo, don't, and this isn't just New York, this is Buffalo, everywhere, like, yo, don't go to that hospital if you can, like, don't go to that hospital. They'll kill you. You know what I mean?
I mean, there's only one hospital in Buffalo that I tell people not to go to.
What's that?
The VA.
Okay.
Well, most of us can't go to the VA hospital anyway.
Yeah, but I mean, in theory, no. But in reality, yes, because like no hospital can really turn you away, right?
I mean, technically, yeah, I guess you're right.
If you have an emergency situation.
But would regular people's insurance cover treatment at a VA hospital?
Oh, absolutely. They take money.
They take money.
They take money, you know what I mean?
No, I'm saying would the insurance cover a visit to the VA? Not would VA take the money,
Sure.
obviously.
Well, yeah, sure. Yeah. It's all the same HMOs.
Oh, okay.
You know what I mean? So it's like, for instance, when I go to the VA, I also have the option of using my insurance, but because it's kind of stupid, you know what I mean? But now the VA is like tiered, right? I'm grandfathered in because of when I served, but anyone who served like a few years after I served,
yeah,
like I just pretty much pay for prescriptions, right? Most procedures that I have done there won't cost me any more than like $50, no matter what it is. But now it's tiered.
Awesome.
Yeah, but that's because I'm grandfathered. That changed after.
That's not the case.
Right back.
I'm just grandfathered into that. Now, a lot, like, it's tiered depending on like your age and when you served. So you might pay somewhere similar to what you pay at a hospital for a procedure. So
are you serious?
Yeah.
So what's the benefit of the VA versus a regular
the cost is offset because you do get, it is a reduced rate based upon the type. See, VA gives like tiered insurance now. So based on the type of insurance coverage you have at the VA combined with, like, if you have your own insurance, it'll offset those costs. You know what I mean? But yeah, it changed. Like, they put people on, they'll take you to like a room and sit you down and like find a way to make it, to put you on the type of insurance program that's most beneficial for you, because they don't, these are veterans, so they definitely don't want to, have you charging an arm and a leg. But just the reality is now, like, with all our advances in medicine, or in spite of all our advances in medicine, like, some of these procedures just cost a lot of money. You know what I mean? And I guess they realize with the volume of people they have now joining the military and coming out and taking advantage of the VA, Like, I don't know that they're
They can't
I don't
afford
know.
it anymore.
Yeah, they just can't afford to, you know, keep operating the way they were. And not to mention, I don't know if you guys remember, but like, I don't know, I want to say somewhere 10 years ago, maybe, you know, it kind of came out how the VA was kind of like screwing veterans. Not here, but just the organization itself was just kind of like
Just
screwing
in
veterans.
general.
Yeah, it was like a big deal. It was like, it was a major news point how the VA was just kind of screwing veterans, and they had all kind of reforms, and after those reforms, you know, cost of things went up.
Well, it was in the news, like, basically, like, a lot of stuff I seem to remember being in the news about, like, veterans, about, like, VA hospitals being, like, completely shitty and veterans getting, like, screwed out of, like, basic procedures.
Well, yeah, they suck. The VA, so here's the thing. So when I was in the military, right, and I noted this when I was like 20 years old. When I was in the military, I realized like
And you weren't even old enough to drink
Yeah, I was.
at 20?
I was in Germany, so the drinking age is 16.
I meant in the U.S.
Oh yeah, but I never served in the U.S.
Oh.
So like
Well, there you go.
yeah, so I was, you know, we could legally drink according to German law at 16. So I got there at 18. So I was, you know, I was good. But what I learned though was all of the occupations, like if you're a doctor in the military, right? You're at best your rank is captain. So say you're a neurosurgeon in the army, right? You're a captain. So you're actually making captain's pay. You're not making what a neurosurgeon would pay, which kind of like enlightened me, like, oh, the reason why you came in the army to be a doctor is because you couldn't have become a doctor, you know, in the civilian world. Or if you could have, you would have. And you wouldn't be making a captain's pay, which isn't a lot compared.
Are you saying that the requirements to be a neurosurgeon in the army is different than in civilian world?
What I'm saying is the schools aren't as hyper intensive as they are if you were to just go to medical school.
Like a normal person?
Right.
Oh my God, that means they're not as well trained as a normal neurosurgeon would be.
Same as your lawyers, any of those higher end jobs. Think about it. Why would you be a neurosurgeon in the army for a captain's pay? Which is like,
I don't know what a captain gets paid. I thought they get paid a lot. Isn't that a high rank?
A cap? No, it's the third lowest officer rank. So
really?
Yeah. So you're talking maybe just base pay, maybe close to $2,000 a month, versus what a neurosurgeon makes per surgery.
Jesus Christ.
You see what I'm saying? Now I'm exaggerating when I say neurosurgeon. I'm just think any doctor, an orthopedic surgeon, any doctor that's in the army, you get paid not according to your procedure. You get paid according to your rank. No matter how many operations you perform or how many medical procedures you perform, you're getting your base pay according to your rank every month. So a lot of times people use the military as a means because yes, you definitely get the experience. You know, not sometimes, and I'm aware of it. Sometimes experience equates to education, right? Like if you're in the hospital all the time, working on patients and getting experience from other doctors who've been there, that amounts to real experience. It's a real education. So then when you get out, you absolutely can go work in these fields. You understand what I'm saying? Sometimes it's not that people aren't as bright as those who are able to go to medical school in the real world. It's just that they learn at a different level, right?
Or medical school just costs money.
Or exactly, medical school costs a lot of money. There's another example. So I'll just go to OCS. You know, some of these schools are long. They're not nearly as long as medical schools. Like I've seen people go for like, you know, a little over a year, but like medical school, when I worked in the hospital, right, these doctors were it's tiered, right? You know how it works as a doctor. Like you start off as like a med student, You know what I mean? And then you
And then a
spend 18
resident.
hours.
And
Yeah,
et cetera.
resident. And you know what I mean? I used to say when I worked in the hospital, you have to be at least a chief if you're going to take care of me. Because I used to work with these doctors. Like, I used to see how you work, how you operate, like, you're not touching me. If I get admitted to the hospital, I need a chief or better. Like, it's not even, like, if you're not a chief, which isn't the highest, you know what I mean? The attending is the highest, but you have to at least be a chief. Because I used to see them. Like, y'all been in the hospital 18 hours a day. Y'all smell bad. You ain't get no sleep. You know what I mean? Like, you're running ragged. I don't want you to be my doctor.
I'd rather have a doctor who sleeps. Thank you very much.
Say again?
Yeah, they should start letting doctors sleep.
No, they have cots there.
That's what the on-call crew is.
Oh.
They have cots.
Just not a
But, like,
restful.
when you're a med student or a resident,
Mhm.
like, think about it. As a med student, right, you got to be in the hospital, 12 to 18 hours a day, and you still got to do your homework.
Mm.
So we're talking like a lot of cocaine. No, I'm serious.
Wait, 12 to 18 hours a day?
Oh, yeah. Not 5 days a week,
Right.
but I
They can
didn't
probably yank cocaine from the hospital.
Well,
I
and
didn't
then
count.
plus doing your homework too?
Yeah, and you still got to do your homework. Like, it's not easy to become a doctor, depending on the type of doctor you're going to become, because it doesn't just take, like, brains, right? You have to have drive.
Mm-hmm.
Like, you really have to have the drive to go through. And you're not even going to make a lot of money for, like, your first 5 years.
Right.
And you got to pay back student loans.
Yep.
You know what I mean? So, like, there
That's
were
why
clerks.
that's why they try to get that money from you when you owe them for your medical bills.
And apparently you have to pay for your cocaine too.
I mean, it's a lot of cocaine. You'd be surprised. Cocaine keeps you awake. It keeps you focused.
What is that?
So let me get this straight here. So people, like, the general public wants to run their mouths all the time about people who smoke a little weed, but, like, people like doctors and lawyers are doing tons of cocaine and nobody gives a shit.
I mean, it's not. I guess it's not like it's public knowledge, but you would think it would be, right? Like, if anybody just tracked the average career of just some medical team from school through their first 5 years, how do you not conclude that they're doing coke? I mean, I know, because I'd sit in the hospital and, like, I was cool with them, and they'd be like, "Man, I wish I had some coke right now." You know what I mean? Like, it was just. But I mean, I'm talking. I worked surgery, so these are surgeons who would, like, perform minor surgeries on their friends in, like, a room in their house.
Jesus Christ.
Yeah, I mean, it's just, this is what they do. You know what I'm saying? Like, they're surgeons. They're learning to be surgeons or working on a surgery team. So it's like, yeah, we come in the hospital and do it, but, like, I can take care of this for free at your house.
That's what tattoo artists do.
Or
when they're
come to my
learning.
house and I'll take care of it.
Well, and barbers right now.
Well, yeah,
Or, like,
barbers were always hooking their people up, learning.
Or, like orthopedic. The two biggest hustles in the medical field, like hustles, like selling drugs, hustles, are women's doctors
Mhm.
and orthopedic surgeons.
Okay.
That's, like, the biggest hustle.
I thought you were going to say that they took the drugs from the hospital and sold them.
Oh yeah. I was
No,
gonna say
no.
drugs, too.
No, but, like, orthopedic surgery is a hustle because it's just bone surgery. And you make a lot of money per surgery. So what they used to do, they used to fill up my zone throughout the week, perform all their surgeries on Saturday, send everybody home on Sunday, and then re-up on Monday. Like, just straight re-up on patients so that you get paid, especially hand doctors. Like,
sorry. What's that scheme again? I don't get it.
They would fill up my zone with patients throughout the week.
Okay.
So I'd just be admitting all these ortho patients, and then they just the whole team would come in on Saturday and they just run through these surgeries.
So they
then,
basically sit in the hospital for a week waiting for their surgery?
Yeah, because you got to get consultations, and you got to make sure that depending on the type of surgery, if it's invasive, you have to at least have 24 hours because you got to, your blood levels have to be a certain thickness. You know what I mean? So yeah, but I mean, not everyone's coming in. Trust me, there are surgeries, like if someone comes in on a Monday, they'll have them out by Wednesday. You know what I mean? But they're all about turnover rate because that's where their money comes from.
Mm-hmm.
Unless it's spine surgery, which is different. You know what I mean? It's either going to be a neurosurgeon or ortho, but their money comes from the turnover rate. So what they do is they get as many patients as possible, and between like Friday and Saturday, they're just knocking out surgeries. Then they discharge them and they re-up again on Monday. And then like female doctors, which I can't think of what they're called right now. I just remember I was talking.
Gynecologists?
Okay, so obstetrician,
Obstetricians, yeah. Baby doctors.
So, no, the gynecologist. So what happens is I was working one day in my zone, and we had a consult with one, and I got to talking to her, and she was telling me that it's kind of like a hustle. And I'm like, well, what do you mean? And she goes, well, women usually tend to have one doctor throughout the course of their life.
Mm-hmm.
And she said, so what can kind of happen is, and she was just breaking it down. She said it can be very shady. And I'm like, well, how so? And she said, well, it can be the same way for men, but she was like, mostly for women. She said, what'll happen is say that doctor wants to go on vacation and they need a little bit of extra money. So you come in and you got something wrong with you and something that they could fix in one visit. They give you a consultation, or they tell you to come back and see them. They take care of it, but they tell you to come back and see them in a month. Doesn't affect you, but you're going to pay insurance twice for both visits. You see what I'm saying? And she told me, she said, and they may do that just because, they need an extra $1,000 for their vacation that they have coming up.
Mm.
What?
Yeah. It's like a hustle. I'm like, wow. I used to, I worked closely with doctors and nurses.
Dude, it makes sense because I've been brought back so many times that it didn't make sense.
Yeah, personal physicians do it with guys too.
Mm-hmm.
And it doesn't hurt you outside of the inconvenience of you having to come back again.
Yeah, well, unless you have to pay another copay.
And them taking your money.
Yeah, a copay. But it's really the insurance that, it's the insurance payoff they're getting.
So what you're saying is that if you were uninsured, they wouldn't make you come back?
I mean, they might if they're just good doctors. But they're definitely, and that doesn't mean they do it all the time, because, people do have ethics and morals, but sometimes people need to pay the bills too.
Shit, maybe I should have been a lady doctor.
They just,
I got bills.
Like I knew doctors, their thing was, most of the doctors I knew, they'd take out a credit card and pay everything in life on that credit card and then just pay it all off at the end of the month.
Yeah.
So, then having people come back for whatever reason is beneficial to them. If, depending on what type of expenses they accrued that month. It can be shady. It's the medical field. Like, it can be shady.
Mm-hmm.
Gotta love not having socialized medicine.
Yep.
But that's why so many people are against socialized medicine, because people benefit from the system that we currently have, and unfortunately it's not the majority of the people.
Yeah.
Mm-hmm.
Yeah, well, think about it. Look how much money it costs to get healthy, right? Or to maintain health. It costs a lot of money. That's not lost on me. Like, you look at some of the systems in other countries, and I'm not saying that it's more ideal or it isn't, because, there's a lot of factors that go into how medical systems work in different countries. What may be great, like Germany's medical system is awesome, but then there's drawbacks. Like young people, I think we had this conversation before, like young people suffer from that, from how great Germany's medical system is. Like if you're young and you're not using the medical system, you're struggling paying half your income in taxes to support a medical system that you probably don't have to take advantage of on that level until you're older. You know what I mean? But yeah,
And then you got the people like, at least I could see this happening in America, and like I've had to check my own thinking on this too. But you have the people who are going to say like, oh, we shouldn't have socialized medicine in America because like you got all those people who make shitty health choices. Like, why should we have to pay for their? Why should we have to pay for like smokers' lung cancer?
Mm-hmm. I mean, if it was transplanted to America just as it is, a lot of people would like our minimum wage would have to go up significantly, or we would have to have some fundamental changes in some other areas of economy, because
people wouldn't be able to pay for it.
Right, because it literally costs Germans for the type of healthcare system that they have in, say, like Germany or Canada.
What we're saying is minimum wage would have to go up before you could implement socialized medicine, because if you're going to increase the taxes to that extent, then people need to be making more money.
Yeah.
Okay, well, I mean, Germans are paying about 8% of their gross income to a nonprofit insurance company called a sickness fund. Their employers pay about the same amount.
Well, but the reality, how that really works when you say 8% of their gross income, Mike, like I lived there, I had to do it myself. If I make $900, half of it goes to taxes. Exactly half.
But that's not all healthcare.
A majority of it is healthcare.
I mean, this says 8%.
Again, that's why I was saying there would have to be fundamental changes to our economy, because what sounds perfect, there are other factors in Germany. So what sounds perfect in one country, like Germany is the way the country is run is completely different than ours. So there are other factors. Again. Like, so in Germany, for instance, like it's not just you know the healthcare benefits. It extends beyond that. And what I mean is, like, if you leave your house and you fall down in the process of going to work or coming home from work, you're covered. Like you can't even be fired, right? They have to hold your job. Like if you work at McDonald's and you walk out your house and you slip on some ice and you break your leg, you're covered to and from work, and McDonald's has to hold your job.
So basically, like workers' comp in Germany, what you're saying covers, like, if you fall on your ass, like when you're commuting to work as well.
Yeah, it's to or from work, and you can't be fired. Like they have to hold your job until you're cleared, medically cleared.
Meanwhile, in the U.S., like you could spend years arguing with workers' comp.
Mm-hmm.
Right. Like all of these things are factored in. I don't know if that's factored into the 8%. I just know all of these things are factored in, which it's ideal. But on the same token, their cost of living is such where I don't think that they notice, at least at a certain age. I noticed it. Like when I was working there on the economy, not when I was working, for the Americans or working in the military, but when I was just living in Germany. And
were you a member of a registered church when you were living there?
No.
What the hell is a registered church?
Yeah, I don't even.
I don't know. It says if you're a member of a registered church in Germany, you also have to pay a church tax of 8%, 9% of your income.
Now, here's the thing, too, Mike. You got to keep in mind, and I could be talking out of school because I haven't lived in Germany since 1998. So I left Germany before the euro. Well, right when the euro became, the main form of currency, but it hadn't. We were still able to use the mark. Like I never spent euros, even though it was, the euro went into effect in like 97, I want to say.
Even as late as like 2001, 2002, like most European Union countries had not switched over yet to the euro.
I know it was active though. like euros were circulating.
Oh no, they were circulating, but it wasn't required that you pay with a euro.
Yeah, I was still using marks, but again, so we're talking, 22 years ago, right? So
Yeah, I mean, see, the reason why that stood out for me, and I don't want to talk like I know because I haven't been to Germany, but it's a well-known fact that in America we pay the most for the least when it comes to our health insurance. So like,
oh yeah,
we've already taken into account that we're paying a lot in America and we're not getting a lot out of it. So like when people complain about taxes in other countries for healthcare, I already know that we're paying a lot in America and we're not getting anywhere near what other people are getting. We have like the most inefficient system.
yeah, but do we pay taxes for healthcare here?
That's the problem. We don't really, like, sure, some of our taxes go into Medicare and Medicaid, but it's a very small amount. Like, I would venture to say, like, they only take, like, 50 cents or something out of my paycheck for Medicare.
How much should we pay in Medicare?
I'm asking because I don't know.
Yeah, I mean,
Inform me.
we're paying whether it's taxes or whether it's out of our pockets. We're paying our premium and we're not getting hardly anything back.
Somebody sounds like a robot.
Yeah,
Cynthia sounds like a robot.
Emily,
Yeah.
are you originally from New York?
I'm from Utica.
We're not
Utica,
talking.
New York?
What are you talking about?
What?
No slaves.
What? Say what?
Somebody sounds like a robot. Anyways, go on.
You said you're from Utica?
Yeah.
Oh, okay. I know Utica.
Yeah, it's halfway in between New York and Buffalo.
Yeah. Yep. Mike, I know you're from Buffalo. Cynthia, you're originally from New York too?
Mhm.
Oh, you're the only original New Yorker on here?
Mhm.
Yeah, you're the only one born here.
Woo, woo. Get out of here, guys. You don't belong.
So Mike,
Mhm.
what do you got for us?
What, for Medicare?
No.
For what?
For what?
For Mike's trivia.
Oh, is it that time?
Your
Yeah,
glass
and
is invisible, Mike.
We only have 6.5 minutes left.
So why don't you start it like immediately when we start the next session? And
Sure.
we can just like keep bullshitting until then.
Okay. Sounds good.
Mike, your glass is invisible.
Yeah.
It's because he put up a virtual background, but like he probably lied and told the background and told Zoom that he had a green screen when he doesn't, and his drink is probably
Why?
green.
Nope. My drink's not green.
What color is your drink?
Wait, the bottle or the drink itself?
The drink itself, or is
Like,
the bottle clear?
The bottle's clear.
And what color is the drink?
Well, the drink's almost gone. The drink's just a little bit on the bottom, but it's like a goldish, amberish, goldish
Well,
color.
because there's something about like that the virtual backgrounds like on Zoom, like it's something like about how you can like how it kind of acts like, you know what happens when like the weatherman wears a green tie and you see the weatherman's like, and you see the weather map on their chest.
Mhm.
Like it's recognizing like one specific color as your background, and maybe because like, the drink is finished now. It's clear, so it thinks it's your background.
Yeah.
Yeah, because it was popping up as invisible. Like it was invisible. I couldn't. Like you had a predator glass.
Yeah.
Yeah, but now that you put it in front of your face, like it's like you're seeing through your face and you're seeing the Golden Gate Bridge.
Mhm.
This is your Zoom trick, huh, Mike? Why does Zoom care about a green screen?
I don't know. It's something computer stuff. I don't know.
Because
Like
it's
what are
because it's
supposed to know this.
generating it's putting the image like in my immersed surrounding. You know what I mean?
Well, it's the exact same technology as like I said, like the weather map, like
Mhm.
on the news. Like they're not standing in front of an actual map with like moving shit on it. Like
Right.
they're standing in front of a green screen pointing
Hmm.
and hoping that they're pointing at the right thing.
Right.
I'll be right back.
Wait, that's interesting. So even whatever's coming through in the background sounds robotic. Like it's being picked up by a microphone.
It's not me this time.
I didn't do it.
That leaves one person.
It's those damn kids.
Nah, not me.
I would have gotten away with it if it wasn't for those damn kids.
I was gonna say my goddaughter's sleep.
You would have gotten away from you would have gotten away with it if it wasn't for that Bushwick Rat.
Yeah, exactly.
The Bushwick Rat. Yeah, I think we spent too much time on him.
Yeah, and we're not gonna go.
I just
I
want
just-
to make that.
I
That's
just
what
had
he
to make a
wants.
sarcastic comment.
And then when people see it, he's going to get that much more publicity. But we won't talk about that.
It's the
I don't know.
45 school of publicity.
I think your doctor rant will get more attention. That was a
Well, yeah,
that was a
especially
pretty
when I put in the tag. When I
pretty
tell you.
boss rant. Like you were turning up just a little.
Man, if I could go in front of crowds like this, I could get a movement of people together.
You were mad. He's
I
like,
am mad, and I'm not going to take it anymore.
he's like if you
I'm
had
mad as hell.
Like I'm not
gonna
gonna
take
take
it
this.
he's like
I'm not gonna take this bullshit no more.
if you had real doctors, they actually pay attention to you and they they ask you questions and they
Yeah. They do.
I thought you
He's like-
said you'd be right back.
Yeah, I will. Well, I'm gonna wait because we're gonna like be kicked.
Break. We're going to take a break, an intermission in less than a minute. So
I just need coffee.
Oh my god.
At what hour? At what hour?
It's like midnight.
Listen, you don't talk for like 10 minutes and then you pop up
And then
as a
you-
critic to be like a critic.
Yeah, don't let robot voice tell you what to do.
well, midnight means different things to different people.
Right,
Right.
right.
Shit, if I didn't have
Oh,
to
yeah.
work tomorrow, midnight would be just the beginning.
Same. I tell my kids all the time, if they didn't pay me to be here at 9 a.m., I wouldn't want to be here either.
Right.
So my problem, Cynthia, is that I never finish a cup
She's
of
not
coffee.
even there.
Yeah, she's not
Oh,
there.
she left?
Hmm.
She walked out of the frame. But you say
Ah.
you never finish a cup of coffee? That's what you're saying?
Yeah, I never finish a cup, so I'm always like reheating it.
Oh, man. Yeah, I know how that feels.
Doesn't sound enjoyable.
I mean, I'm good with it.
Yeah.
No, it's why I still get iced coffee even in the winter.
No, don't tell me you're one of
Yeah.
those.
Well, not all the time, but I mean, like, when it's 40 degrees.
You know what?
Oh,
It can
okay.
make
If it's
sense.
20
depending
degrees,
on-
I'll get hot.
It also depends on your situation. Like, if you're in some office and they got the heat turned up a lot, like, go ahead and enjoy an iced coffee. You know?
It just
'Cause,
doesn't
like-
taste good.
Oh, well, it depends on the iced coffee. Some iced coffee's made with good coffee. I mean, if you're talking some lower level Dunkin' Donuts